Government is putting its hopes on the 18 to 34-year-olds, I should say, to help revive the country's waning vaccination program. The younger segment of the country's adult population has been lining up for COVID-19 shots since yesterday. 248,873 vaccine doses were administered on Friday alone, and 53,290 of those were in the Western Cape. The province's health MEC, Nomafrench Mbombo, joins us now to talk more about that and the COVID-19 situation in the Western Cape. MEC, grateful for your time. Yesterday you managed to vaccinate about 53,000 people, at least the number of shots administered. Are you still seeing large numbers turning up today, Saturday?
Yes, but noting that on Saturday we don't open all the sites, specifically the big sites like in town, the CBD, like City, ICC. But in future we'll be opening more as we open the Athlone Stadium. That will also be the drive-through. But yesterday was good because actually we vaccinated 18,000 more compared to our previous statistics where we had the best days. I think we must thank the I call them TikTok, the bundles of joy who came in numbers. Yesterday we had about 150,000 plus of the 18-year-olds and upwards who not only registered, but out of those about 50-something thousand plus were vaccinated. So indeed, it looks like we might get at 2 million sooner. We are at 1.6 million plus people who have been vaccinated in the province. And we were targeting at least to vaccinate about 200,000 per week, but it seems as if that 200,000 might come sooner, and the 2 million might come sooner than we expected if we see the momentum and also the enthusiasm that is coming from our bundles.
And it's important that you mentioned the issue of enthusiasm and momentum, because about a month or two ago, when the vaccine program opened up to the so-called breadwinners, age 35 to 49, there was a lot of excitement. Centers were packed for the first few weeks, and then the numbers started to drop. So how do we keep the momentum going?
I think this generation, this young generation, it's completely it's completely different from the other generations. It's a generation of socializing, and when you indicate that at least once everyone eligible is vaccinated, at least the country will open up. It's a generation of social media. It's a generation of competition where they could be competitive in regards to that. But what is crucial, what you are saying, is that we shouldn't be like straitjacket them and put them in the similar surroundings or in the context of what the other oldies, we normally call them the fossils, because we do know that in the young people, they don't like to go to clinics because they don't see themselves as sick. So in the mainstream health facilities, you won't see much of them. Hence, for example, Monday, Tuesday, I will be in Central Karen, Beaufort West, where we will be joining a music track that is being offered by the National Government of Communications Information Services. So we have to keep up the vibe because they are always there. And also we must make sure even going to the places where they will frequent to. I even said that when the clubs are open, they go for the clubbing. Probably we must just have it jabs before the jolling part of it. And if they go for the sporting, if the sport is being open, we must make sure that we bring to at their doorstep instead of all trying to divert the traffic to the normal mainstream health facilities.
And in the Western Cape in particular, it's very important that young people, especially in the 18 to 34 cohort, be vaccinated, because you've seen with the Delta variant now dominating, more and more young people actually ending up in hospital as a result of rather serious COVID illness.
Yes, because of the high transmissibility, you do see quite a number of young people and even children actually in the third wave as compared to the previous waves. But at least what is consoling is about you don't have a higher number of the severe illnesses and deaths among the youngest. It's still the same as wave 1, wave 2, and now wave 3 in regard that the higher risk factor is the age, which is the 50-50 above, and also if you've got comorbidities. But of course, it is worrisome that we see the children and also the young people get infected. The worrisome part is about these are the people who potentially are super spreaders, and then they will end up infecting their gogos and their mkulus. That's why we are saying to them, we are vaccinating you, although you are not necessarily a vulnerable group as a high risk factor to severe illness and disease and also death, but at least you should be able that where there's a percentage where they'll end up not contracting the virus, and also to prevent mutation, because we don't know, coming fourth wave, there might be maybe another variant. Like now we're talking about the Delta, in the second wave we're talking about the Beta. We might not know what's going to come up. So that's why it's crucial for the young ones to vaccinate, but not leaving the older ones as the vulnerable behind, like the homeless people. Yesterday, we vaccinated the factory workers, where we brought them through the taxis and coming to the Grand West Casino, which is a private vaccination site, but that is accommodating as many of the other people who could be able to be vaccinated there.
And is the message getting through from government to the older people, especially when I was speaking to Dr. Nicholas Crisp from the National Health Department? He was saying, an area of concern, for example, is men in South Africa in the 50-plus bracket who just aren't turning up in sufficient numbers.
With men, you also need to understand their health-seeking behavior. It has always been different. Men, just like young people, although I'm not saying that men they behave like young people, but generally you find that for them, they don't like the mainstream. Mostly in non-COVID cases, men only go when the illness affects their daily activities. That's when they all go. So that's why even with men, even during the November month, we call it Movember, where we bring many men. It's a men's health month. If you think that you'll be driving men to come to normal clinics, they won't come. So that's why these pop-up clinics, mobile clinics, where like you go to the malls and then you will have a gazebo and then you have a mobile that is there. It's a similar thing that we're also driving in regards also for the COVID. But also taking note that with the over 60s or even over 50, mostly over 60s, you would have expected more men than women, because the life expectancy of men is usually lower. Therefore, it's not unusual when you get a percentage. But what we have to zoom into is about what's going to happen to now AMA bundles, these young ones, because we do have a high level of the cohort among the males in this age group. So we have to watch carefully around that aspect.
And are you seeing a change in vaccine take-up in areas such as Mitchell's Plain, for example? I had a discussion right here on Newsfeed PM with the Premier, Alan Winde, who had gone out there to get his COVID-19 shot and was saying there isn't enough as far as the number of people who are registering on EVDS and those turning up at centres.
Khayelitsha, first of all, it has improved because it's in the metro, Khayelitsha and Mitchell's Plain. It used to be the one. Khayelitsha has improved tremendously. Actually, last Monday, I think over 300 that have been vaccinated at one goal, at one place, where the City of Cape Town Health Services, they brought these pop-up vans going street to street. And there's a high level, actually, of uptake in the Khayelitsha as compared before, because we even went to the taxi ranks, and we'll be going actually even to some of the clubbing areas that are being utilized by the young people, where you could also bring the music vans. And the excitement part is that they will be opening the biggest hall, which is the Niue Hall or Tamba Hall, where actually we will be driving as many of the young people. Khayelitsha, compared to other townships in the Western Cape, has got high level of the young people. With the Mitchell's Plain is different, because with the Khayelitsha, it was about the access and also the uninformed people. In Mitchell's Plain, it's completely different. They are misinformed because the influencers or the people who are the community leaders who influence people in many behaviors are mostly the people who know what's happening, the GPs. So when people have got the same GP in the household that have been looking after Oma, Opa, and then us and others and the children, and is the one who's an anti-vaxxer, becomes problematic. When you believe too much that you're in your pastor, or whether Christian or even the Muslim, which is what is dominating there, tells you that vaccines has got to do with the satanism. then it makes it difficult because we have got a high level of the anti-vaxxers in that community. But things are improving in certain areas where we bring pop-up buses at the malls, especially now during the upcoming end of the month, where these OMAs and OPAs will be coming for their social grants. Together with the SASA, we could be able to make a difference as we did. In Central Karoo, where I'll be going, it's a highly rural farming community, fewer people, but you get about 100 kilometers in between one household and others. The way it shows that it's a vast community where it's quite stretchy. That one, it's not surprised that you find that there's a poor uptake because of the health illiteracy. And therefore, that's why we will be going, and just to ensure that even if you get Nobababini Batatu in a certain farm, at least you'll be able to get there. But again, the issue of the anti-vaxxers who might be community leaders, because it's quite a conservative kind of area, is what we are busy trying to resolve.
All right. Western Cape Health MEC Nomafrench Mbombo, good to speak to you today, ma'am. Thank you.
Thank you.